Well, greetings. This is Dr. Bill Wyatt again, and we're going to talk something today about obstructive management of mouth breathing. Actually, just put it in common words, if you a chronic mouth breather, it has a tremendous effect on your development of your facial structure, and it is amazing what the tongue, when you are a mouth breather, you have your tongue in the bottom part of your arch here, and it widens the lower arch out, where the upper arch kind of drops inside of it. That it'll go to one side a lot of times, and people will shift their jaw, and so they can eat without the cusp being bumping into cusp to cusp. Isn't too good a chewing method in there. And there's just a lot of things to think about in this case, and that's just a part of it. But we go in here to expand the upper arch on this young man. He's still in his 30s, but he weighs 312 pounds, I believe. And this was several years ago when you didn't see a 300-pound guy very often, and we had to try to separate. But his sutures would not come apart. In other words, they stuck together, and I couldn't get them apart. But we kept pushing on this, and you can widen anybody's arch if you just go slowly and put the reverse torque in there where you're keeping the root going with the crowns. I do believe you could expand anybody's arch regardless of how old they are. I've got a lot of older people that we've expanded their arches with them. Now a lot of these, the sutures separating, we were able to start and put pressure in the anterior part of the mouth as well as in the back part, and separate people in their 30s and a few of them in their 40s. But this young man was in his late 30s, and I could not separate him. The sutures wouldn't come apart, but we just kept on, and we stretched the bone structure. And the vault will be like this. As you go apart, it comes down this way. In other words, this doesn't separate and do that this way, but it'll level out, and then the stretching, and actually the bone thinned out. And I've got pictures of the upper arch taken down through the nose, and I'll show you where the bone actually stretched on this. So this case has a ton of information to learn, if you can learn the things that we did here. So let me get going on this case, and we'll try to show it. Now he's a huge guy. I mean, he's not fat and gobby fat. He's just muscled up and everything. But he weighs over 312 pounds, or about that much. And when we started out, he opened his mouth, and you see his upper teeth are going inside of his lower teeth. And that doesn't show there, that's about what it is. For him to chew, he put his teeth out even further than that to get his teeth together. The upper teeth wouldn't go down in behind the lower teeth here. You see this, the upper teeth would come in something like this, and the lower tooth would be up in like that. But actually he had to get it worse than that to get it together, to chew with it. So let's go on to it. This is the side view of his face, and here's the upper arch. And you can see the side, this is all in, and his lower teeth are still coming out like that. We'll get some other pictures here of it, and that's the upper arch again, like that. Now, the lower arch, looking at it from up above, it's just a lot bigger, but you don't see the upper arch inside of it like that. But now here you do. Now, it was my thinking that he really didn't go around this bad all the time, but he chewed his teeth, hit further out here, but he couldn't get them together back here, so he brings his lower jaw further out, and now the upper teeth are literally inside the lower teeth. And you think you couldn't deal with this without doing surgery. Now, we did come in, and I think we took a bicuspid out, maybe the first or second bicuspid right there. Now, looking at it from the front, when he closed all the way down, he was like that. Now, this came about simply by mouth breathing. It's hard for people to think that just the tongue will widen this out. And now he has to stick his lower jaw forward a little bit to get it up and down there where he can chew good. But you know where the bite's a little closed there. Look at it from the other side, the same thing. Now this is the 6-year molar here, and it should be somewhere like this back here. Now it's that much further forward when he bites now, but I think he's bringing his jaw out further than just it's comfortable would come together, but just to get the teeth inside where he could do some chewing a little better there. Now, here are a series of pictures we took. I tried to separate the palate. Now the palate runs right through there, and that's I want to erase that. As you can see, but we cranked, and I put pressure out here and pressure in the back, and this, I could not get the suture to separate. And here's another one. Now we separated the palate that far, and it still didn't come apart, but look at the bone structure in here. It's considerably different from the bone structure we started out with. In other words, the x-ray is going through this, so this bone structure is thinned out, and we have cranked that apart that much. In other words, it didn't separate, but it leveled out, and the bone just stretched out. It's thinner bone. Now we kept going with that pressure on there, and the bone was still thin here, very thin, and later on the bone began to thicken up in here. This is the sutured area, and the bone is thickened up, and as we still have that distance we have gained in the separator. Now we took it out and everything, and the bone stayed out in that position. So we were able to take that and stretch the bone structure. I took a lot of pictures like that to see. We thought we were trying to get it out. Now, we had thought of coming in, and we were going to take this tooth out here, use this. And I went and I retired from this office, and they didn't think they could straighten this tooth up right here very good. So he ended up taking something else out in the middle here, and maybe extracting that lower wisdom tooth. Now here it is after we finished, after I left the office there, this center line's there. Now he could chew with his teeth back in a normal position. In other words, his lower jaw was out like that. Now they've got a deal going on. I put a hole that a bar right around here going all the way around his mouth like that. And got him back in a class 1 relationship. So we're missing some teeth on the bottom, you see. I've got a lower second, or else it's the first bicuspid we took out on the bottom. And this is the way his teeth met after we finished. Now, there's a ton of stuff to learn about this. If you're a chronic mouth breather, you're not going to spread the lower arch out where it will go over the upper arch, but there are many other things that develop too. Like if you're chronically breathing through the mouth, you usually swallow improperly, and you'll develop more facial length in here than you normally would. Now, in this fellow's facial structure, he stayed down fairly well. And that's the upper arch. After we finished, you see how large it is, and the lower arch, we brought it, reduced it in size, and you see we took the first bite, looks like here, out on him, and brought that back and got it where it was chewing on top of that. And so this was the way we finished up with him. Now, if you can try to understand how much force the tongue has, it's hard for people to understand that. The tongue is being used wrong too, it will make them go different ways in here. So we knew that the tongue was kind of crowded, and you would shorten this, and now you have the tongue pressure may be stronger. You have to retain the class 3 correction and holding it in order. It may move the whole complex forward as long as you keep it in real good retention till it gets to a place that the tongue pressure is equal to the lip and cheek pressure on the outside, and the body pushes the teeth to a certain point where this is equal all around. And that happens to everybody. When you quit putting pressure in there, if the pressure is not, if the teeth that aren't at the correct pressure area, then they will move toward that area. Now, if you hold it in retention, the tongue pushes on this, and you hold it class 3 retention. We've got a video on that. It will bring the whole complex, the upper and the lower, forward until it gets the right pressure right here. Or if you've got it too much, it may drift backward, but in his case, it drift forward. Excuse me. Now here is the guy. After we got through with him, we had the upper teeth with the retainer and the lower teeth also. Excuse me. Now he is a very nice guy. I mean, I enjoyed working on him. Even though we had pressure on his maxilla, he didn't fuss about that at all. And we have a system here of working where we can do just virtually anything you need to do with anybody's teeth. It doesn't matter how old they are, what nationality. I think he's Hispanic, and it doesn't make any difference what color the skin is or anything else. You can still move people's teeth as long as they live. And it has been taught. I didn't go to the regular orthodontic school, so I wasn't taught that you couldn't do that. And so we did it anyway, and you can do it. And so that is the truth, and it'll be that way 100 years from now. And so you can expand the facial structure, the upper or the lower. If you want to, just put enough pressure on there and put it gently. You can do it, and you can do most of this expansion with this large, what we call a Big Daddy arch wire. But if you're doing a lot of expansion in there, you need to put buccal root torque in your rectangular wire along with your Big Daddy arch in there. I think we used a Big Daddy arch on this young man. Now there's the upper where it was in. I'm going to run through these slides real fast so you will go through and study if you want to. Now this is the lower. He's got a pretty bad cavities in several of these. Now this is what we used, and we extracted a tooth. And to jump the bite, we put some blocks back in the back, and we got this where this would go over this lower arch, and then we would take those off down there. So I want to show you exactly what we did. You can actually lower the vertical a little bit by putting blocks in there. All right, they had a palatal separator in the upper. See, we were going, and you see those pictures, we had these things. See this, they went out like that. We had this thing spread out as far as it would go. And we got it to go out, but we never got the sutures to separate in here. And I've got pictures of that, and these things are out like this. I don't know some of those pictures. Well, that's going apart like that. I got a little separation right there, but the sutures did not come apart. So we took these teeth out, close that in there, and then we could close down on that. And we put retention on it. Now we've pushed this palatal separator out to this point. I think I took the front part off so I could line these teeth up after we had expanded as far as we could get this thing. You saw those first deal, these were almost together right here. Now this palate did several things. It drops like that, and that helps you go out, and then it just stretches, and the bone will grow and move out to wherever you want it with it. You just keep the pressure. If you think a bone doesn't move on the person, look at that person when he's 21 or 25, and then you look at him when he be 75 or 80. I'll guarantee you he'll be bigger and fatter, and the bone is shifted to take care of the weight that the person has, and it'll be completely different from that bone structure that was on that young man when he was 21, and when it was kind of quit growing, we'll say, to speak. All right, we took the first bicuspids out, and we reduced that down, and we got that underneath that way, and then we took these blocks off right here. Now this is adult orthodontics, and I'm trying to get our organization set somebody. We've got some good lecturers and people that do orthodontics, and they know how to do it, to teach this adult orthodontics. I think there's a group going to come, and we're going to try to go over these cases where we've expanded adults like this and show them how to do that instead of bridging, just taking and close those spaces up. And that works. There's a palatal separator. Now that bar on the back didn't get that tooth too good, but we took it off. I'm just running through this whole thing. Now this is totally different. We've got his bottom teeth inside his upper teeth. Now we may have changed the pressure area, so you're going to have to keep it under retention until the whole thing goes out to where the pressure is the same on the outside as it is on the inside. That's a bad shot there. That's opening it up and getting the bottom teeth underneath there. And you see how we close that with a spring. There's the upper arch. Now, here's the bottom arch. After we closed it up and we took these blocks off, we still had it over on that side. All right, I'm going to go through some of this. Now, when I left, I was going to straighten this up and just show that you could do that. They were afraid they couldn't do that, so they took the teeth out.